Welcome back to our Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park. Today we are going to be talking about the steps that are involved in a filling procedure.
Absolutely. So remember that once the bacteria attacks the tooth and breaks the enamel, a cavity is formed. And then when there's a cavity, guess what? We do have to place a filling.
Yes, there are several reasons why we place a filling. Probably the most common reason is decay or a cavity. They can be small or large. Notching at the gum line and chipped teeth is another reason.
Yeah, the other ones are in case you want to replace an amalgam filling and you don't like that dark appearance in your mouth, we place a white filling. The other reasons we could is then if there's an open contact between your teeth with an old filling, we replace it just to make a tighter contact so that food doesn't get in between. Sometimes if you have deeper grooves or pits on the teeth, then we place a filling.
So here are the steps involved in a filling procedure.
Okay, we start by placing a little topical in the area that needs to be numb. It does really help because it takes the edge off, when you get that little pinch. It is quite comfortable.
Yes. Next, we numb the area, and we will test the area to make sure you are numb. But once we get started, if you feel anything at all, just raise your hand and we can give you some more anesthetic. We will make sure that you're comfortable throughout the procedure.
Absolutely. Okay, then we use a handpiece to remove the decay. Depending on the depth of your decay, it may be shallow to deep. It may take long, it may be really, really quick. Then we make sure that the box of the tooth is perfect so that we can place the filling.
So after the decay is removed, we want the tooth to be completely dry and free of saliva. So we use a gauze and a cotton roll to isolate the tooth.
Yeah. Then if the decay is in between the teeth, then we have to place a little band that goes in between the teeth, so that way it takes the shape of your tooth.
And after that, we apply an etch, which will make the tooth porous, which will allow the bond material to stick to the tooth. And if the decay is deep, we will place a liner, which will reduce sensitivity. Now, in some cases, teeth can have so much decay and be so deep that after the decay is removed, you may need a root canal, but your doctor will talk to you about that if that's the case.
Then a filling material is used, which is called a composite. That's placed in layers on your tooth, and it's cured with an ultraviolet light.
So after the filling is hardened with the ultraviolet light, at that time we will remove the gauze and the cotton roll and the matrix band.
Yeah. Then what we do is we shape the filling to match the level of your tooth, so any kind of flash or you feel that it's high, we reduce all that, so we make sure that it's really good.
And then we check your bite. We use a special paper that we'll have you tap down on to ensure that your bite is back to normal.
After the procedure is done, we give you a post-op instruction, which we make sure that you don't eat on that side till the numbness wears off, because you can easily bite the numb area.
Yes. Fillings may have sensitivity for a couple of days to a week. If it continues for a longer period, you may have to come back for an adjustment, because even the slightest little high spot on the tooth can cause some problems. So it's just a quick couple-minute appointment where we'll get you in and adjust that spot.
Yeah, so this is what you can expect for during a procedure of a filling. So hopefully this is quite informative. If you have any questions, please don't hesitate to call.